Hi, my name is Elizabeth Stapp, and this is my collaboration and leadership reflection video for assessment number 1 in my Leading into Interprofessional Practice course. I'll be reflecting upon an interprofessional monthly meeting that was held at my place of work, in this case, a dialysis clinic, examining what happened, identifying aspects of this meeting that had a positive effect, as well as other issues and areas that continue to need development and improvement. At the end of last month's team meeting, my coworkers, supervisors, and I went over several topics that pertain to our workplace and workflow. Topics such as infection control regarding central venous catheter care, time off requests for PTO, setup requirements for treatment packs, as we've had many new employees join our team, daily chore list requirements for technicians, proper documentation within TMS in regards to opening, closing, and ozoning our clinic's machinery, as well as RN documentation duties, laboratory protocols, and lastly, utilizing our team's communication log for updates throughout our workday. This meeting was conducted at the end of our 12-hour shift in our clinic's conference room after all the patients had left the building. It took approximately 1 hour of discussion, and we were given meeting notes to follow along as our clinic manager directed the meeting. We were also provided with printed policy regarding CVC dressing changes, as well as P&P for treatment initiation and discontinuation with CVC accesses. The topic of infection control was heavily emphasized throughout the meeting, and our team spent the longest discussing about that than all the other topics. What went well during this interprofessional collaboration was how our manager conducted the meeting and how the time is spent speaking. She was straight to the point and provided us with policy and procedure regarding areas for our team to read through and improve upon in our notes, and so we could reference back to stay on track throughout the meeting. Throughout our team meeting, our discussions that we had with our manager, she was actively engaged while addressing our comments and concerns, which was effective as it limited gray areas of confusion and solidified what we all needed to do going forward. Aspects that could use improvement were perhaps the time of day and the setting of our monthly meetings. After our team had worked a 12-hour shift, it's fair to say that our minds and bodies are tired, and that is and has been a struggle to then attend an extra hour-long meeting at the end of our workday and to also stay actively engaged throughout. Alternative solutions have been proposed in the past by several coworkers, such as setting up a Zoom meeting on Sundays. It's the only day our clinic is closed, or on Saturday nights, as Saturdays are usually low census for patients, and our day ends earlier, to conduct our monthly meetings, so to improve our information retention and attendance and participation. In a meta-review article about interprofessional collaboration, the authors provide insights into how poor collaboration can lead to inefficient management of human and financial resources. Poor collaboration amongst healthcare providers can lead to gaps in communication, coordination, and decision-making. This can result in adverse patient outcomes such as medical errors, delayed treatments, complications, which not only impacts patient health but incurs additional costs for corrective measures. Moreover, when collaboration is poor, team members may experience higher levels of stress, frustration, and burnout. This leads to high turnover rates, requiring more resources for recruitment, training, onboarding new employees, affecting both human and financial resources. In regards to my team's collaboration efforts, holding suboptimal meeting times in combination with staff fatigue could lead to also suboptimal information retention and engagement, resulting in errors and inefficiency, potentially in clinical practices. From an article about transformative leadership in nursing practice, the authors, including Ferraria et al., provides insights into effective interdisciplinary collaborative and strategies. I believe my team would best benefit from incorporating continuous quality improvement as a leadership strategy to improve upon these issues. This strategy aims to foster a culture of continuous quality improvement where critique is encouraged and used to refine processes and that could enhance teamwork. This involves evaluating outcomes, identifying areas for improvement, and implementing changes collaboratively. Since my team has continued continually shared these concerns regarding meeting schedules and employed potential solutions. Management, if they valued growth in this area, would be open to feedback and prioritize finding feasible solutions as a team. Implementing these best practices could help enhance my team's effectiveness, improve patient care outcomes, and optimize resource utilization in healthcare settings. In the article by Waldron Pierre et al., which focuses on interprofessional collaboration to implement cognitive rehab in patients with brain injuries, I believe that there is a specific collaboration strategy that could also help my team achieve its goals and work together effectively. By prioritizing conflict resolution and incorporating more shared decision making where input from all team members is valued and considered in developing treatment plans and goals, this would ultimately foster a more positive and effective work environment. This would only be possible through employing open dialogue, active listening, mediation techniques to address conflicts constructively and maintain positive through working relationships. In conclusion, reflecting on my experience with the interprofessional collaboration at my dialysis clinic, it's clear that effective communication, clear goals, and leadership engagement were key strengths. However, the timing and setting of our monthly meeting poses challenges due to staff fatigue and impacting engagement and information retention. Drawing from these insights from scholarly sources, it's evident that addressing these issues is critical to avoid inefficiencies in patient care and resource management. Thank you.